you, sir. Good afternoon. I am going to present our research on perceived stress and associated factors among BSc Nursing undergraduates in University of Jayewardenepura, Sri Lanka. As you know, the nursing education in the conventional universities was implemented in 2005 in University of Jayewardenepura. Before that, we had post-RN degree program from Open University of Sri Lanka. And today we have 5 other conventional universities provide BSc Nursing degree programs. And our BSc Nursing program contains comprehensive proportion of clinical training. And especially graduate nursing education is a stressful situation, and undergraduate viva voce examinations, there are different types of examinations. It can be a challenge. An unfamiliar clinical environment with various risks and hazards. Some students, they have not been in hospitals until they come for our degree program. So it can be a new experience. An extreme expected precision of care. They can't do any harm to the patient. They have to look after patients without any harm and think about safety of the patient. And new equipment and devices. They have to be familiar for new equipments when they are working in clinical setting. Further, they have to perform highly technical procedures. They have to do invasive procedures, catheterization, IV cannulation. So they have to be familiar and be competent to perform those procedures. Especially our undergraduates, we don't provide them transport facilities for Colombo South Teaching Hospitals or Sri Jayewardenepura General Hospital. So it can be a difficult task for them, and they have to spend a lot of money while they are learning in the program. Therefore, during last 8 years period, we have continued our program, and we felt that students are facing a lot of difficulties to learning if it is in mild stage. And nursing students' stress in the clinical setting is associated with complexity and acuity of patient care, interacting with members of the multidisciplinary team and clinical environment. And another article, another author said, nursing clinical practice component cause high level of stress, and student nurses need a large amount of preparatory work before their clinical placements. The objectives of our study. General objectives are to determine the perceived level of stress among stress and associated factors, and second one, to determine the factors associated with perceived level of stress among BSc Nursing undergraduates. We use descriptive cross-sectional study in our study, and our setting was BSc Nursing degree program, University of Sri Jayewardenepura. And the study population was all the students attached to BSc Nursing program. And all the registered BSc Nursing undergraduates was included into the study. And the total study population was recruited, and there was 105 students during 2013 academic year. For data collection, we use self-administered questionnaire, which was developed by incorporating experience of the researchers, and we use published literature, and we use perceived stress scale, which was developed by Cohen, Kamak, and Mermelstein in 1983. And there were 3 sections in our questionnaire: demographic characteristics, variables related to stressors, and perceived stress scale. We administered our questionnaire by Sinhala or Tamil language, which can be easily understood to the students. Perceived stress scale is a mostly used psychological tool for measuring the perception of stress, and it has been validated by Somasari et al. In 2005 in Sri Lanka, and it has been used in several studies in Sri Lankan setting. The PSS 10, there are 10 items in the scale, and it has a possible range of scores from 0 to 40. And we divided stress level, low stress and high stress. If they have less than 20, we call them low stress. And if the student had more than 21, we call them as high stress category. And PSS score 20 is the operational cutoff value for the upper bound. And the data collection was done in the mid of one academic term, where the assessments and examinations are minimal and there is no additional stress among each batch of students. And students were participated voluntarily, and we explained the procedure and the purpose of the study before we did the data collection. Because if they overmark, there is no point of taking all the information. We wanted to see whether they actually have stress and what are the associated factors. So data analysis, we used statistical package of social sciences version 16, and for demographic characteristic of students and their common stress related symptoms were assessed by descriptive statistics, and stress and associated factors were identified by using chi-square test, and strong predictors were identified by binary logistic regression analysis. Variation of student stress levels and effect of associated factors on each batch of students were assessed by one-way ANOVA test. And we summarized all the findings by odds ratio with 95% confidence intervals. Before we start this study, we obtain informed verbal consent, and we maintain anonymity and confidentiality, and ethical clearance was obtained by the Ethics Review Committee of Faculty of Medical Sciences, University of Jayewardenepura. Our study, we found that in our the sample, majority were female students. It is around 71%, and there were 87 students in our study, and majority were Sinhalese and Buddhist. Mean age was 24 years old. Mean perceived stress of our study sample 21.57, and nearly half of the students, 52.9%, had high level of perceived stress, and it indicates that half of our population at high level of vulnerability to compromise their health due to stress. And from that, majority of the students were female undergraduates. And then we try to see what are the stress related common symptoms, and 75.9% explain that they easily feel tired during stress, and 69% said get nervousness as a common symptom. We try to see whether the perceived stress is associated with the personal factors. The personal factors like gender, ethnicity, religion, whether they practice religion or family income, whether they are doing exercises or having hobbies. None of these personal factors were significant with perceived stress in our study sample. And we try to see whether there is mean difference of the stress level among each batch of students, and it also was not significant. And when we see at the academic activities and the association with perceived stress, we found 5 factors that are related with stress. They are too many seminars and assignments, peer competition, inadequate support in clinical area, families' unrealistic expectations, and lack of guidance and counseling. From these 5 factors, we wanted to see whether there is any significant association when they are in independent level. So we performed direct logistic regression, and there were 5 independent variables in the model. and the full model contained all predictors was statistically significant. So finally we found two factors which are associated with perceived stress: family's unrealistic expectations, such as having good grade at the end of the exams and having distinction for each subject. So helping health conditions in the family like unrealistic expectations, and lack of guidance and counseling was the second factor. And if the students having families unrealistic expectations, they can have 5 times more stress than other students. So as a conclusion, nearly half of the students had high perceived level of stress in this study, and there was no significant difference in stress among student batches. And main common stressors we found are peer competition, too many assignments and seminars, inadequate support in clinical area, families' unrealistic expectations, and lack of guidance and counseling. From that, the unrealistic expectations of the family was the strongest predictor of high stress, followed by lack of guidance and counseling. So as a recommendation, I think most of the audience is with the lecturers and lot of people from nursing educators. So we have to think about the curriculum demands, that we should not overload the academic workload for students and facilitate role of the clinical training for undergraduates. And educators, administrators and clinical supervisors and parents must be sensitive to the needs of the undergraduates and provide necessary guidance and support as well as pastoral care when students are under stress. Also we have stress management, coping skills development sessions in orientation programs. But I think it is better to continue during the academic years to avoid this stress. So I would like to acknowledge Vice Chancellor USJP, Dean Faculty of Medical Sciences and Head of the Department of Medical Education and Health Sciences for granting permission to conduct this study, and all the nursing undergraduates for providing their support, and academic and non-academic staff in the BSc Nursing Program, USJP. So these are the references I use for this presentation. Thank you.